Hello, everyone, and welcome to the Understanding Medicare webinar. Before we jump in, I want to tell you a little bit about who I am, so I'm not just some face talking at you through the computer screen. My name is Tom Staley, and I'm an independent financial advisor and insurance agent in Bendorf, Iowa. The company I work at is called True Financial Partners, and we are on Utica Ridge Road in Bettendorf. I grew up in Bettendorf my entire life. I went to the University of Iowa and then returned home to begin my career. Now, I've been teaching this class for about 8 years now at local libraries and also Scott Community College. Now, over the next 30 to 45 minutes, you're going to learn quite a bit about Medicare. It's probably going to leave you with some questions as well. So I encourage you to use me as a resource. I'll leave my contact information on the screen, and please do not hesitate to reach out at any time. Here are the topics we're going to talk about today. We're going to start with parts A and B of Medicare. We'll talk about Medicare supplements versus Advantage plans. That's a big one for a lot of people turning 65. We'll talk about Part D prescription drug plans, when and how to enroll. And then finally, we'll talk about Medicare and how it works with employer insurance. A lot of people are working past 65 these days, so it's important to know how Medicare coordinates with employer insurance. A quick disclaimer before we jump in. This is an educational event. Now, as you're approaching age 65 and you're thinking about attending different seminars and things like that, there are really two forms of events. There are educational events and there are sales events. So educational events are just that. It's purely general information, nothing plan specific, and that's what this is today. Now, a sales event is quite different. It's usually sponsored by one particular plan. They only talk about the benefits of that particular plan. And, typically they try to get you to sign up for something at the end. So today is nothing like that. You can sit back and just enjoy the education. This has not been reviewed or approved by Medicare or the Social Security Administration. They simply don't do that sort of thing. All right, let's jump in. We're going to start off by talking about Part A, which is your hospital insurance, and then we'll move on to Part B, which will be your medical insurance. Again, Part A is your hospital coverage. So anytime you're in a hospital, Part A is going to be what's covering you in most cases. So to dive a little bit deeper into that, Part A includes things like inpatient hospital care, skilled nursing facility care, nursing home care. Now notice in parentheses I put non-custodial, and that's very important. I'm going to come back and touch on that here in a moment. Hospice care and home health care. Now Part B is your medical coverage. So this is pretty much anything outside of the hospital. So outpatient care, general doctor's visits, labs, clinics, preventive care, ambulance services, durable medical equipment, which is things like canes, walkers, and CPAP machines, and also mental health. Now, when you think about Part A versus Part B, you're probably going to be using Part B more than you're using Part A, right? Hopefully you're going to the doctor more than you're going to the hospital. Now, it's important to know what Part A and B covers, but it's equally important to know what it does not cover. So some things not covered by Part A and B, probably the biggest one on this board is long-term care. So that is extended stay in a nursing home, assisted living, or the need for home health care. Now you might say, well, Tom, under Part A, it says nursing home care. And that is true, but Part A only covers the non-custodial care you receive in that setting. Non-custodial means the actual health care. It does not help with custodial care. So custodial care would be the help with activities of daily living. There are 6 of them. It's eating, bathing, dressing, toileting, transferring, and continence. So, the activities of daily living, when people typically need long-term care services, those are the things they need help with. And Part A does not cover those items. So, long-term care needs to be addressed outside of Medicare. And if you have any questions about how to address long-term care, let me know. I've actually created a webinar on long-term care insurance alone. Other items not covered by Part A and B, routine dental, vision, and hearing is not covered, which seems kind of silly to a lot of people, especially if you come from employer insurance. Most of those plans include some sort of dental, vision, hearing. Medicare, however, does not cover it. Now, this is something we could also look to cover with a standalone dental, vision, and hearing plan. Now, I will say I've searched far and wide for a dental vision hearing plan that makes sense. And most of them, you just pay a lot in premiums for the benefits you get out of the plan. So in most cases, a lot of people are better off self-funding dental vision hearing. Parts A and B together create what's called original Medicare. Okay, they call it original because this is the way it was designed when it first came about in the 1960s. Now, this is a federal program, right? Benefits are provided through the federal government. Now, one of the best things about original Medicare, or Parts A and B to the federal government, is that there are no networks. You can go to any doctor or provider in the nation that accepts Medicare patients, and that's a beautiful thing. Now I'd like to shift focus and talk about cost, and there's always two categories of costs I like to talk about. The first category is the premium. What do you pay to have the insurance? So that's typically a monthly premium. And the second category is, what are the out-of-pocket costs? So what do I pay when I actually use the insurance? And that comes in the forms of deductibles, co-pays, and co-insurances. So as we go through Parts A and B, we're going to talk about both premiums and out-of-pocket costs. Now let's take a closer look at Part A hospital coverage. The premiums for Part A are typically free. So the way this works is, if you or your spouse have worked for more than 10 years and you have your 40 quarters, there's no premium for Part A. And they like to say it's free, but actually you just already paid for it, right? Every paycheck, a little bit came out for FICA taxes. A portion of that went to pay for Part A. So again, for most people, there is no premium to have Part A. Even though there's no premium, there are out-of-pocket costs involved with Medicare. So let's look at a hospital stay here, for instance. Days 1 through 60 in a hospital, you'll be responsible for a $1,632 deductible, and then nothing for the rest of the 60 days. Days 61 through 90, you'll pay $408 per day. Days 91 through 120, you'll pay $816 per day. Now, after day 120, there's no coverage. Again, this kind of falls back on the long-term care. So after day 120, you are responsible for all costs. Now, I want to focus in on this deductible here. Most of us are probably used to a calendar year deductible, meaning if I had a calendar year deductible of $1,600, once I reach that, the insurance is now kicking in for the rest of the year. And then January 1st, it resets, right? That's a calendar year deductible. This Part A deductible is not a calendar year deductible. It's based on a benefit period. So long story short, if you go to the hospital more than once in a year, there's a chance you could pay that deductible more than once. Now these costs up here, this deductible and then this cost per day, these are what we call gaps in Medicare. Medicare was meant to help cover your medical costs, but it was never meant to cover everything fully. So these gaps, a lot of people look to cover these with what's called a Medicare supplement. And we're going to spend a lot of time talking about supplements in a few slides here. Now focusing on Part B medical coverage, unlike Part A, there is a premium for Part B. And in 2024, most people will pay $174.70 per month for Part B. Now, one quick note, Medicare, there's no such thing as a family plan on Medicare. So if you and your spouse are both on Medicare, you will each pay $174.70 per month. Now, I say most people pay $174 because higher income earners actually pay more, and we're going to talk about that on the next slide here. Now, you're going to find out as you get closer to Medicare, the Social Security Administration has a big hand in all of this. They oversee the premiums, and they also handle the enrollment in Medicare. So the reason I put this here is because if you're already collecting Social Security income, that Part B premium can actually be deducted directly from your Social Security check. Now, if you're not collecting Social Security yet, you're waiting, that's no big deal. They'll just send you a bill for this premium. Now let's look at the out-of-pocket costs for Part B. So what happens when I use Part B medical coverage? Well, the first cost is a deductible of $240 per year. Now, notice I said per year. This isn't like the Part A deductible where it's per benefit period. So this is a simple to understand calendar year deductible. And $240, that's like the least expensive thing you'll pay in healthcare. Now, after you pay your deductible, you then move into co-insurance. This is where you pay 20% of the bill, Medicare pays the other 80%. Now, anytime you see a percentage, your alarm bells should be going off, okay? Now, most of us, like if we come from an employer plan or even like an Affordable Care Act plan, those typically have what are called maximum out-of-pockets, meaning, it's a spending threshold, and usually it's around, I don't know, $4,000 to $8,000. And once you reach that threshold in spending in a calendar year, the insurance now comes in and covers everything 100%. Now, there is no maximum out of pocket for Medicare Part B. So if the bill is $1 billion, you pay 20% of it, right? Now, people think of Part B, they think, 20% of a doctor's visit, that's 20, 40 bucks, no big deal. But what we have to remember is Part B covers anything outpatient. So if you go to the Mayo Clinic to have chemotherapy, well, 20% of a $500,000 chemotherapy bill is $100,000. So this coinsurance right here for Part B is the biggest gap in Medicare. Again, a lot of people look towards a supplement to come in and cover this, so they don't have to worry about it. Now, final thing with Part B out-of-pocket costs is excess charges, and this is fairly rare, but I think it's important to cover. And what this is, it's a possible extra 15% if the doctor or provider you go to doesn't accept what's called Medicare assignment. And this Medicare assignment, that's kind of a weird term. Essentially what that means is, the provider doesn't agree to Medicare's payment system. And if they don't, they can legally charge 15% above the listed price, and that's something you're responsible for. That's called an excess charge. Now, Medicare.gov has some useful tools, including a provider lookup. So this provider lookup tool, it'll tell you, one, does a doctor accept Medicare patients, which should always be your first question. And then number two, it tells you if they accept Medicare assignment, in which case you don't have to worry about this extra 15%. Now, I mentioned on the previous slide that the more you make, the more you pay for your Part B. This is called Income-Related Monthly Adjustment Amounts, or IRMA for short. So the way this works is it's based on your modified adjusted gross income from 2 years previous. So, we're in 2024 right now. So what they're going to be doing is looking at your tax return from the year 2022. And, it works a lot like our federal tax bracket. There's a bracket for individuals, and then there's a bracket for married filing joint. And if your income 2 years ago, now keep in mind, it's not 2 years cumulative, so you don't add 2022 and 2023. It's only income for 2 years prior, so in the tax year of 2022. So individuals making less than or equal to $103,000 will pay the base premium for their Part B. Married filing joint, 2 years ago, if your modified adjusted gross income was less than $206,000, you will also pay the base premium. Now, if you made over those amounts, you can just follow this chart down, and you can see that this total premium just continues going up and up and up, and gets pretty expensive for higher income earner individuals and couples. Now, this is important. As a financial advisor, I like to talk about, income planning and how important it is. And I just want to talk about a couple areas I see people trip up. The first area is what we call required minimum distributions, or RMDs. And for most people, this is either going to be age 73 or age 74, depending on, when you were born. And what this is at that age 73 or 74, the IRS requires you to start withdrawing a certain amount of funds from your retirement accounts. So, think of your IRAs, 401ks, 403bs, or if you have like a 457. The IRS requires you to start taking income from those accounts. So what a lot of people don't realize is that when they have to start withdrawing from those accounts, it's going to, or it could affect, your modified adjusted gross income. because the money that is in those qualified retirement accounts has never been taxed, right? Now, disregard Roth IRAs; those are different. Those are taxed on the front end, not the back end. But when you take your RMDs, whatever amount you have to withdraw, you add it to your taxable income for that year. So, when you turn age 73 or 74 and you have to take RMDs, just be careful. That could be a reason to possibly start taking withdrawals from your retirement accounts beforehand, right? That just comes down to proper income planning. The other area I see people trip up is when they're doing Roth conversions. And the idea of a Roth conversion is to take money that is in those, qualified retirement accounts like IRAs and 401ks and convert a little bit to a Roth IRA over a certain period of time. The idea there is to pay the tax bill now while tax rates are low. And once the money goes into the Roth, it grows tax-free forever, which is a beautiful thing. And as a financial advisor, I think Roth conversions are a great idea and everybody should be considering them in some way. But you have to keep in mind that, anytime you make a conversion, you add it to your taxable income for that year. So again, that is another area where people could mistakenly bump themselves up into the next tier for Part B IRMA. Now, if you did make over these amounts 2 years prior, you do have the right to appeal. So, Medicare is going to send you a letter that says, here was your income from 2 years ago. And, they obviously get that information from the IRS. The next page of that letter are reasons why you could appeal. So, these are life-changing events. So some of them might include retiring, reducing work hours, death of a spouse, things like that. So if any of those life-changing events have happened to you, then I would definitely go through the appeal process. It'll save you a good chunk of money. A quick review of what we've talked about so far. Part A is your hospital insurance. Again, the premiums are free for most people, but there are significant out-of-pocket costs like deductibles and copays. Part B, medical insurance. Premiums for most people are $174.70. Higher income earners will pay more. And there are also significant out-of-pocket costs, including deductibles, copays, that 20% coinsurance, and possible Medicare assignment costs. Now let's fast forward the clock and say you've enrolled in Medicare. And again, we're going to talk about when and how to enroll in a few slides. But let's fast forward the clock and say you've got your red, white, and blue Part A and B card in your hand. Well, now what do? You are now approaching probably the biggest decision you'll have when it comes to Medicare. And that is, do I enroll in a Medicare supplement or Medicare Advantage plan, right? This is like Coke versus Pepsi. There are people and agents out there that swear by the supplement side. There are people and agents out there that swear by the Advantage side. Now, I'm here to tell you that it's totally dependent on your individual situation. There's no magic bullet when it comes to this decision. So, over the next few slides, we're going to talk about the differences between these two. Let's take a deeper dive into this. So on the left, I have the Medicare supplement, and on the right, I have the Medicare Advantage. Now, a couple quick notes. Neither of these are required, okay? These are both optional. You could certainly have Part A and B alone through the federal government, but I will say, if you do that, it could make it harder to enroll in one of these later on. And most people do go on to add one or the other, which, nationally speaking, there are more people enrolling in the supplement than the Advantage plans at this moment in time. Now, these are both offered through private insurance companies. So we're stepping out of the realm of the federal government and we're now talking private insurance companies. Now, Medicare supplements are also known as Medigap plans. So if you ever see an advertisement or a mailer that says Medigap, just know that they're talking about Medicare supplement. And also Medicare Advantage is also known as Part C. It's Part C of Medicare. And I'm not a fan that is Part C of Medicare because when you hear Part C, you think, oh, it's a part of Medicare. I need that. But Part C is totally optional. Okay, that's Medicare Advantage. Now, again, both are offered through private insurance companies. Medicare supplements work with Parts A and B, while Medicare Advantage plans replace Part A and B. Okay, That's one major difference between the two of these. Now, because Medicare supplements work with Part A and B, there are no networks. No matter what insurance company you choose for your supplement, you can go to any doctor or provider in the nation that accepts Medicare patients. So anywhere where they accept that red, white, and blue Medicare card, your supplement is also guaranteed accepted. That's a beautiful thing. Okay. Medicare Advantage plans, however, they typically have networks. So there are networks that are more strict. There are some that are more lenient. But in general, if you have an Advantage plan, you're going to want to stick to your network. Now, supplements, the plans are standardized, and you're going to have a lot better idea of what I mean by that in a few slides. But in general, Medicare supplements are very easy to compare to one another. Okay. Now, Medicare Advantage, on the other hand, are very different from plan to plan. So let me give you an example. There's typically, I don't know, 20 to 40 different Advantage plans in every zip code, and they are all different. They all have different networks, different deductibles, different co-pays or co-insurances if you go to the doctor or you see a specialist, right? So what I like to compare to is like, when your employer would give you 2 or 3 health insurance options at the beginning of every year, and you have to sit there and go through and compare each one. It's a lot like that, but instead of 2 or 3 options, there's 20 to 40. So it's, this is comparing Advantage plans is a big process. With the Medicare supplement side, you would typically go on to add on a standalone Part D drug plan. Now, we haven't talked about Part D, but that one's pretty easy, D for drugs, right? Medicare Advantage plans, however, typically have Part D included within them. So it's kind of like an all-in-one. In fact, they like to advertise that a lot, all-inclusive, all-in-one Medicare Advantage plan. And that sounds nice, except, when they include the drug coverage, it's like when you're comparing all the plans, first you have to find a network that you like, then you have to make sure you like the deductibles and, out-of-pocket costs, but then you have to make sure they cover your prescriptions. So it just adds another layer of complexity when you're comparing these plans. Medicare supplements don't have any add-ons or what I would call freebies. So there's no dental, vision, or hearing with most supplements. Whereas Advantage plans typically do include some sort of like dental, vision, hearing, or, like a gym membership, maybe a discount for over-the-counter stuff. Now, I will say that these benefits there's not a lot of substance to them, but it is better than nothing, right? The supplement doesn't offer anything. Now let's talk about cost. In either case, whether you choose a supplement or an Advantage plan, you still pay your Part B premium, which again is $174 for most people. Now, with a Medicare supplement, you're going to pay an additional premium to have this plan. And, in the Quad Cities, as a general idea, you'll pay an additional, I don't know, $80 to $130 per month for your supplement. And the reason there's a range there, 80 to 130, is because there are supplements that only cover some of the gaps left behind by Medicare, while there are some supplements that cover almost all of the gaps left behind by Medicare. So it's like the more you want, the more you pay, right? Now, Advantage plans, you pay your Part B premium, $174 per month, but then there's typically no additional costs for the Medicare Advantage plan, okay? Now you might be thinking, Medicare Advantage plans have no premium. What's the catch there? So, this little illustration, I think is a good takeaway from this class. This is very important. So, and it comes down to the 2 categories of costs, premium versus out-of-pocket costs. So with the supplement, you pay more in premiums, right? You pay your $174 Part B premium plus an additional premium for the supplement. So the premiums are no doubt more than the Advantage plan. But the supplement covers more out-of-pocket costs. So when you go to the doctor, you need certain services, your out-of-pocket costs will be very low and in a lot of cases 0. Now with Medicare Advantage plans, you kind of flip that script, and in return you get lower premiums, but the more you go to the doctor and you need services, costs start to add up. So it's kind of like, which end do you want it, right? That's the question. Now, one very important piece of information here, when you're first turning 65, you get to enroll in any supplement you want without having to answer any health questions whatsoever. Now, outside your initial enrollment period, besides a few limited circumstances, if you ever wanted to change your supplement, like go from one company to another, or go from a Medicare Advantage plan to a supplement, you would be subject to health questions. And they are very strict. It's pretty hard to pass what they call Medicare supplement health underwriting. Okay. Now, the reason I like to stress this point is because, a lot of people turning 65 are healthier, and they think, well, geez, the Medicare Advantage plan premiums are so low, and I don't really go to the doctor a whole lot. So I'm going to start in an Advantage plan, and when I get older or if I get sick, I'll switch to a supplement. Well, they don't realize that if you want to do that, you're probably going to have health questions. So it's kind of like, well, when are you going to make that decision to switch? Probably when it's too late, right? And you can't pass the health questions. So when I'm working with folks, I always tell them, whatever decision we make here between the supplement versus the Advantage, we need to assume that this is the plan you're going to have for the rest of your life. Now let's take a closer look at the supplement side. And there's a lot going on this screen, but I want to draw your attention to this top row here. These are all of the Medicare supplement plans. You see they're lettered A, B, C, D. There's a few letters missing in there. Now, one quick distinction, this is not Part A and Part B of Medicare. This is Medicare Supplement Plan A and Medicare Supplement Plan B. Totally different from Parts A or B. Now, over here on the left, we have all of the gaps left behind by Parts A and B of Medicare. Some of these we covered, a few of them we didn't. But like, for instance, here's the Part A deductible. That was a little over $1,600, and that's something you could pay more than once in a year. Now, if I follow this across, you can see that if I go with Supplement Plan A, I'm still responsible for that. It's not covered by the plan, whereas all of these other plans cover it in some way or fashion. Here's the Part B deductible. This is only $240 per year. Part B coinsurance, this is the big one. This is the 20% with no cap. And you can see just about all of them cover it in some way or fashion. Now, there's really only two Medicare supplement plans in the surrounding area, in the Quad Cities that make sense. And that is the Plan G or the Plan N. So what I'm going to do is I'm going to make this screen a little bit easier for us to read. And we're going to focus in on the G and the N here. So the Plan G supplement, you can see it covers every single gap in Medicare except for the Part B deductible. So if I have a Plan G, the only cost I'm responsible for is this $240 Part B deductible. After I reach that, assuming every service I receive is covered by Medicare, you will have no out-of-pocket costs. That's a beautiful thing. Now, Plan G covers more, so it costs more. So, when I threw out that range of $80 to $130 per month, the Plan G is going to be closer to the $130 per month. Now, Plan N is also a very competitive plan in the surrounding zip codes. This one also does not cover the Part B deductible, so you're responsible for the first $240. It doesn't cover Part B excess charges, which, if you recall, that's a possible extra 15% if you go to a provider that doesn't accept Medicare assignment. Now, this is pretty rare, and I'll say, I have a lot of clients who have a Plan N supplement and have never ran into an excess charge. But, if you're going to enroll in a Plan N, it's definitely something you should know about. Now, here's the biggest difference with Plan N versus Plan G, and it's the Part B coinsurance row. So again, if you have Part A and B alone and no supplement, you'd be responsible for 20% of the bill with no cap. With Plan G, that's totally covered. With Plan N, if you follow these three asterisks over here, you will pay $20 for office visits and $50 flat for an ER visit. So instead of a percentage, it's $20 flat or $50 flat. And that's a lot easier to stomach than 20% of the bill. So, when I think when a lot of people look at the differences between these plans, I see a lot of people who are healthier and don't have, family history of health issues, opting for the plan N because they save money on premiums, whereas people who have, some more health concerns tend to gravitate towards the plan G. Now, they're both great plans. There's no right or wrong answer between the two. When I'm working with my clients, one thing I like to do is I like to compare the plan G to the plan N. So what we'll do is we'll grab quotes for both plan G and plan N. Now, before I continue, be very careful about how you go about, acquiring quotes for supplements or even advantage plans. Like if you go to a website and ask for a quote, typically they have you enter your contact information. And as soon as you click enter, your information is sold to agents across the country and your phone will start blowing up. So yeah, try to avoid that mistake. So, this is an example, but in the Quad City area, a plan G goes for about 120 and a plan N will go for about $80 per month. So let's make a little comparison here. The difference between these two is about $40 per month or $480 per year. Now, if I take $480 and divide it by 20, this $20, remember, that's a co-payment for an office visit with the plan N. So if I take the savings and divide it by $20, that's 24 visits, meaning your break even is 24. So if you go to the doctor more than 24 times in a year, the plan G makes sense. If you go less than 24 times, the plan N makes sense. Now, most of us probably don't go to the doctor 24 times in a year. But remember, whatever plan we pick, we need to assume that this is the plan you're going to have for the rest of your life. So you might not have 24 visits a year right now, but when you're in your 70s and 80s, you might. Now we've talked about plan G versus plan N. So now I'd like to shift focus and talk about, well, how do we go selecting a private insurance company for a plan G or plan N? I mentioned a few slides back that Medicare supplements are standardized, meaning if I'm looking at a plan G with a company, let's call company A, and a plan G through company B, they are the same exact insurance. No matter which company you go with, the only out-of-pocket cost you would have is that Part B deductible, right? So that makes comparison pretty easy for us. But there are a few items that we do need to compare. So the first one being monthly premium. What are they charging for the plan G? And, this is pretty shocking, but, if you looked up your zip code, you might find there's a company offering a plan G for $200 per month, while there's a company offering the same exact plan G for 120, right? So now, at the same time, we don't necessarily want to go with the cheapest company either. So there's a few other things we compare. So company rating. There's a company out there called AM Best. The letters A as in Apple, M as in Mary, and the word best. And their role is they rate insurance companies. So they give them a letter grade based on, how quick they pay claims, customer service, things like that. A plus is the best, A minus, and so on. My standard is I typically don't go below A minus, right? We want to work with somebody reputable. Another thing we compare is how long the insurance company has been in the market. So obviously we don't want to go with some startup that was founded by some college kid in his dorm room last year. Next, household discount. So, I mentioned there's no such thing as a family plan with Medicare, but with supplements, if you and your spouse enroll with the same plan, they will typically give you a household discount from anywhere between 7% to even to 14% I've seen in some cases. Now, if you're single, you probably don't care what the household discount is, but if you are married, this could be significant in the comparison process. Now, final point of comparison are age increases. So with Medicare supplement premiums, they are going to increase as you get older, right? The older you get, the riskier you become to an insurance company and your premiums go up. Now, there isn't a single insurance company out there that guarantees what your rate increases are going to be, but what we can do is we can look to see what they've done to premiums historically. And it's a pretty good indicator of what they are going to do to your premiums as you get older. Let's shift focus and talk about Medicare Advantage. So, if you're interested in the Medicare Advantage side, how do we go about, finding a good plan for you? So, like I mentioned, these typically have networks. HMOs, health maintenance organizations, are the most strict, meaning if you have an HMO, you're going to want to stay in network. Otherwise, if you go out of network, all the costs will probably be on you, except for emergency care. All Advantage plans will cover you for emergency care, even outside of network. Next is Preferred Provider Organization, PPO. This is a little bit more lenient, meaning, if you do need to go out of network, the plan will typically help cover the costs. It won't be as good as if you went in network, but it's better than nothing. Now, one thing about Medicare Advantage plans is typically, you need referrals to see specialists. So let's say you wanted to go to you might have to talk to 2 or 3 people before, they pay for something like that. Whereas if you have a supplement, all you do is you schedule a visit and you go. So that's, a major difference there. Again, most Medicare Advantage plans include prescription drug coverage within them, and they may include additional benefits like dental, vision, hearing, silver sneakers, over-the-counter discounts, things like that. So how do we go about shopping for an Advantage plan? Well, as I mentioned, there's usually 20 to 40 Advantage plans in every zip code. So, how do we look at these and compare them? The best tool for this, and the tool I use with my clients, is Medicare.gov's Plan Finder tool. So, this is the official government website. And you start off by entering your zip code, and you will also want to enter in all of your prescription drugs, because remember, these Advantage plans typically include prescription drug coverage. So, we enter the name of your drug, the dosage, how often you take it. We select a few pharmacies you want to compare, and then you click go. Now, that's when the homework begins, because it's going to populate, all of these different plans. And that's when you go through and you look at all the different deductibles, co-payments, co-insurance, maximum out of pockets, things like that. So that's really where the homework begins. Let's move on and talk about Part D drug coverage, which we kind of touched on earlier. Part D for prescription drugs. Now, if you go the supplement route, you would typically go on to add on a standalone Part D drug plan. Whereas, again, if you go with the Advantage route, you'll typically have prescription drug coverage included within the plan. Now, these are also offered through private insurance companies. And if you go the supplement route, it's actually pretty common that you'll have one private insurance company for your supplement and a totally different private insurance companies for your prescription drug plan, just typically how it works out. Now, there are late enrollment penalties with Part D, which we'll talk about in a little bit. Now, I can't tell you what the premiums and out-of-pocket costs will be for your prescriptions because it's totally dependent on the drugs you take. So the best way to find a Part D drug plan is actually the same tool we use for Medicare Advantage plans. You go to Medicare.gov, and actually one of the first selections, it asks you, are you looking for a standalone prescription drug plan, or are you looking at a Medicare Advantage plan with prescription drug plan built in? So again, we type in your zip code, the name of your drugs, dosage, and how often you take it, select a few pharmacies, and we click go. Now this tool is really nice because it's going to tell you, of the 25 standalone prescription drug plans, which one is going to be the most affordable for you based on the prescriptions you're taking. Now I get this question a lot, and that is, Tom, what if I'm not taking any prescriptions? Do I need to enroll in a Part D drug plan? And the answer is yes. And again, that comes back to the late enrollment penalty. If you don't enroll in a drug plan when you are eligible, they're going to start the clock on that late enrollment penalty. So for those folks that aren't taking any prescriptions, what we do is we enroll you in the least expensive plan premium. So that way, we're keeping your costs low, but we're avoiding the late enrollment penalty. Now, the nice thing about prescription drug plans is there is an annual window to change prescription drug plans without any health questions, okay? And that's pretty critical because, as we get older, the prescriptions we take are going to change. So it's really important to utilize that that fall enrollment period to change drug plans or at least review them. All right, so far we've talked about Parts A, Part B, Medicare supplement versus Advantage plan, and now I'd like to talk about how do we enroll in Parts A and B of Medicare. So the first question is, when do we enroll, right? Well, most of you that are turning 65 are approaching your initial enrollment window. So this is a 7-month window surrounding your 65th birthday month. So in this example, let's say John is turning 65 in October. He gets the 3 months before his 65th birthday month and the 3 months after to enroll in Parts A and B of Medicare. Now, when I'm working with folks, we always try to hit these first 3 months to enroll in Part A and B. If you wait until your birthday month or the 3 months after, the effective date or when the coverage start is just pushed out further and further, okay? Now, the earliest your Medicare can actually start is the first day of your 65th birthday month. So, if John enrolls within these first 3 months, his Part A and B benefits will start up October 1st. The only caveat to that is if your birthday is on the first of the month, your Part A and B benefits will actually start up the first of the month prior. So if John's birthday was October 1st, his benefits would actually start up September 1st, kind of a weird rule they have. Now let's talk about how to enroll. So, the question you need to ask yourself is, are you currently collecting Social Security income? If the answer is yes, you will be automatically enrolled in Parts A and B of Medicare. If you are not collecting Social Security, so if you're waiting to collect, you will need to reach out to the Social Security Administration to enroll. Now, there's 2 ways to reach out to the Social Security Administration. You could go online to ssa.gov. If you have a portal already, you can log in. If you need to create a portal, I'm going to warn you, it's not very fun. The second option, I should say there's actually 3 options. Second option would be to call Social Security, and you can call the national number or your local office. Number 3 would be actually to go down to your local office and enroll. Now, I mentioned earlier, there's a fall enrollment period. It's called the annual election period, and it runs from October 15th through December 7th each year. And this is when you can change either your drug plan or your Advantage plan without any health questions, okay? Now, notice in here, nowhere does it say Medicare supplement plans. So again, a lot of people make the mistake, well, I can change from an Advantage plan to a supplement plan in the fall. And that's not the case. You can only change from one Advantage plan to another. Same with drug plans. So, the older we get, the more our drug situation is going to change. So this is a nice time to go back into that Medicare.gov plan finder tool, type in your new prescriptions, and see if you should make any changes. Now, there are 2 areas people can run into late enrollment penalties on Medicare, and I'm not going to get too far into these for time's sake, but Part B and Part D drug plans have a late enrollment penalty if you do not enroll when you turn 65. Now, one very important note, if you have employer insurance, you may be able to delay Medicare, and we're going to spend a few slides here in a moment talking about that. But this is really for folks who don't have any insurance or have like Affordable Care Act plans or like individual health care. If they think, oh, I don't need Part B or Part D, well, guess what? Medicare is going to charge you a late enrollment penalty. And the kicker is the penalties are paid for the rest of your life. They never go away. Now, finally, let's talk about Medicare and employer insurance. So, if you're still working or your spouse is still working, you're probably wondering, well, what do I need to do with Medicare? Do I need to enroll? Can I stay on the employer insurance? Will there be late enrollment penalties? So let's focus in on this. Now, one quick note, Medicare doesn't distinct whether the insurance is through your own employment or your spouse's. So if you have employer insurance through whether it's you or your spouse, this slide applies to you. So whether we need to do anything with Medicare when you turn 65 depends on the size of the employer. So if it's a smaller company, less than 20 employees, Medicare would be the primary insurer and the employer insurance would be the secondary insurer. Whereas if it's a larger company, more than 20 employees, Medicare is actually the secondary insurer, while employer insurance is primary. So it kind of flip-flops there. Now, a quick note before we progress. If you have COBRA or retiree coverage, This is not considered employer coverage. So the takeaway there is if you have COBRA or retiree coverage, you absolutely need to enroll in Medicare when you turn 65. Otherwise, the clock will start on those late enrollment penalties we talked about. Before we dive any deeper here, I want to stress that, if you're turning 65 and you have employer insurance, you really, really need to work closely with the HR department and also an insurance agent like myself to make sure that you're not making any mistakes because, any mistakes that do happen here can be pretty expensive. Okay. Now, let's take a closer look at Medicare and employer insurance for smaller employers here. My screen will flip. There we go. So a smaller employer, less than 20 employees, again, Medicare is the primary insurer and the employer insurance would be secondary. Well, since Medicare is primary, you absolutely should enroll in Part A and B when you turn 65. You will also want to enroll in a Part D drug plan. So think about it like this. When it comes to the supplement, you need to decide, do I want the employer insurance to be secondary or do I want a supplement to be secondary? Now, again, one area, there's a lot of areas people trip up with this, but like some people might say, well, I want the supplement because it's going to be more affordable, which is typically the case. But if you have a spouse who is under 65 and depends on your employer insurance, well, that's a situation where you would want to keep the employer insurance in most cases, right? So something to think about there. Now, looking at a larger employer, so more than 20 employees, in this case, Medicare is secondary and the employer insurance is primary. What this means is you could technically delay Medicare as long as you want, as long as you're still working and covered by the employer insurance. And this avoids all the late enrollment penalties associated with Part D and Part B. So you wouldn't be making any expensive mistakes there. Now, even though you could continue the employer insurance, you should always compare what the employer insurance looks like to Medicare. So, this is a comparison I help people with quite a bit. So what we do is we look at the premiums and out-of-pocket costs for the employer plan, and we look at the premiums and out-of-pocket costs for Medicare. And it's kind of a, which route do we want to go? Now, again, another key consideration there is if you have a spouse who is dependent on your employer insurance, well, then it's almost a no-brainer to continue on the employer plan and delay Medicare without any issues. Now that concludes our topics today. And before I let you go, I want to address one question that I always get, and that is, Tom, how do you fit into this whole Medicare thing? So I'll explain that for you now. There are really two ways in which I help people with their Medicare. The first is the planning, right? As you've realized, there's quite a bit that goes into this, especially if you have employer insurance. You really need to make sure you do that correctly. And the second way in which I help people is the actual shopping for the supplements, drug plans, and advantage plans. So as an independent agent, I work with many different insurance companies, including the big names and are familiar with. Now, on top of that, whether you work with me or you go directly to that insurance company, you pay the same price. So really, it's kind of like you get my knowledge and my expertise at no cost. So if that's something you're interested in, please let me know and, shoot me an email or give me a call and, I'd be happy to help you through this process. Thank you and take care.